have small children, doctor's visits, immunization appointments, and the inevitable trips to urgent care, they can be consuming enough.
Absolutely. But a much quicker visit, just twice a year, can save your little one from a variety of future health issues. I visited with a pediatric dentist who told me that first appointment should be much earlier than most think, well before your child can talk.
We recommend that kids come and have their first dental visit within 6 months of their first tooth coming in, or at the very latest at 1 year old.
This can be shocking to some parents who say, my baby barely has any teeth and only just started eating food, but keeping gums clear of bacteria and cleaning sugary liquids off the teeth they do have can save their smile.
The kids that are sleeping with a bottle, usually it's a bottle of milk, sometimes it's juice, things like that. The problem is it leaves a lot of time with that sugar on the teeth, and so it can cause a lot of damage. And what we'll see is, we'll see some staining start on the front teeth. We'll start to see stains or cavities on the back teeth.
And beyond keeping their gums and teeth healthy, an earlier trip to the dentist can detect other issues that could even help your still toothless little one have an easier time nursing or drinking from a bottle.
We'll look for any type of abnormality. Lip ties and tongue ties are things that we see a lot here. It doesn't, just because a kid has a lip tie or tongue tie doesn't mean that it needs to be removed. We doesn't necessarily need surgery, but we'll do an evaluation to see if that's limiting any range of motion.
So if you struggle to brush your baby's teeth at home and you're thinking, there's no way my kid is sitting still long enough to let the dentist look in their mouth, never mind to get a cleaning in.
So kids in the dentist office and kids at home are very different.
Yay!
We'll typically have them sitting in mom or dad's lap. We'll lay them down so we can get a good look. We'll usually use a toothbrush with some with Profi paste, something a little more abrasive, get off any plaque or stains, and yeah, we usually will get a few seconds to take a good look in there. This hand's for me, just like that. Hi. All right, and then we're gonna brush your teeth. Look at that. Oh, that's cool, huh? Good job.
And if your sweetie is still a sucker for the pacifier,
there's a specific timing when we want the binky habit to stop. Between 14 and 36 months is the recommendation, and we can avoid a lot of future orthodontic work if we kick that habit.
Nice job.
And if you've never attempted brushing your baby's or toddler's teeth, doctors say start small.
When we're at home, just introduce it little by little, as much as you can. Show them it's not anything that's scary, if that's what they're worried about. Get some fun flavored toothpastes. My assistant is going to come and she'll walk you out and help you schedule the next appointment.
Okay, sounds
all
good.
right.
Get a coin.
And can I get you a coin? All right. Having kids here is not usually as big a deal. It's a fun place for them to experience it.
And according to the CDC, 20% of children between the ages of 2 and 5, the years critical to proper speech development, have at least one cavity in their baby teeth. The center also says children with poor oral hygiene miss more school, have poorer grades than kids with healthy teeth, among other issues. Digestive problems and sleep disruption also associated with bad oral hygiene.